Welcome, welcome, welcome. So my name is Carly Farrell, and I am so happy to be here as the President and CEO of Trillium Health Partners. It's a deep privilege being here as the CEO. I represent in this role over 12,000 people who work, practice, learn, and volunteer here at our hospital, and have worked tirelessly over the last 2 years as we battled the pandemic, and before that to serve our community. So thanks for being here today. It is a big day at Trillium Health Partners. It's a very special day for a few reasons. Today is the 10th anniversary of Trillium Health Partners. So it's not only a day to reflect and celebrate the past, we're looking to the future. The next steps and what we're going to announce today, as I said to the Premier and Minister earlier, they brought with them both hope and our future, and we are so pleased. So I want to start by giving a warm THP welcome to the very special and honored guests with us today. First and foremost, thank you Premier Doug Ford for being here, Deputy Premier and Minister of Health Christine Elliott, Minister of Infrastructure Kinga Surma. Also joining us today, Ontario's Secretary of Cabinet, Michelle D'Emmanuel, who needs no introduction. We are so blessed in our community to have the best MPPs who are here with us today. We have Rudy Cazzetto, Deepak Anand, Natalia Kusendova, Sharif Sabwe, Nina Tangri, Khalid Rashid, and Christine Hogarth, who could be with us. Thank you, thank you, thank you. You have always had our back, and we appreciate it immensely. We are also here with Mayor Bonnie Crombie, of course, our great mayor of this city, who has been with us every step of the way. And no THP celebration would be complete without one of our founders of the hospital and THP's honorary guardian, Hazel McCallum. I also want to welcome my colleague Michael Lindsay, the President and CEO of Infrastructure Ontario, who is joining us today and has partnered with us on the projects we're going to talk about. I am very proud to be joined by several THP representatives, our board chair, Michelle Darling, our board of directors, Caroline Riseborough, our President and CEO of the Trillium Health Partners Foundation, our THP Foundation board of directors, and our THP leadership team. I'm looking right at our Chief of Staff, Dante Mora, and our Chief Nursing Executive, Catherine Hayward-Murray, and of course, all of our people who are joining us from all of our sites, over 12,000, as I say, who work day in and day out to serve our community. Thank you for all of us. So we were to have Chief Stacey Laforme with us today. Chief Laforme, of the Mississaugas of the First Nation, Credit First Nation. Unfortunately, he couldn't be here, but I'm honored in his stead to begin with a land acknowledgement. So as we begin, the land on which THP operates has been the site of human activity for 15,000 years. It is the treaty lands of the territory of the Mississaugas of the Credit First Nation. It is also the traditional territory of the Huron-Wendat, the Haudenosaunee. The land and the lakes in this region continue to be home to many First Nations, Inuit and Métis communities across Turtle Island, which is currently known as North America. They continue to mobilize, live, and care for these lands and its inhabitants. This area was subject of the Dish with One Spoon Wampum Belt Covenant to share and care for the lakes. This covenant challenges everyone, Indigenous folks who have been stewards and settlers and who continue to arrive to share the resources around the significant waterways of the Great Lakes. We have much work to do together to make healthcare better and our community stronger. We at THP are committed to that and honored to be working with the Mississaugas of the Credit First Nation and all First Nations people as our journey continues. So with that, I'm pleased to get us underway, and I would now like to welcome Michelle Darling, our board chair at Trillium Health Partners, And as she does come to the stage, I do want to recognize our board chair. She joined our organization in 2007. She was a member of the Credit Valley Hospital Foundation, and then she served a vital role in amalgamating our foundations, and then came on to the Trillium board, and now serves as one of our great governors who's brought us through the last 10 years. So thank you, Michelle, and I welcome you to the stage.
Thank you very much, Carly. Someone asked me this morning if I was excited, and I can't begin to tell you how excited I am. It's just a wonderful day for us. So good morning to all of you, Premier, Ministers, NPPs, Mayor, Councillors, Regional Chair, community leaders, and distinguished guests. I want to thank all of you for being here today to mark this incredible milestone in our hospital's history. I'd like to acknowledge and thank my colleagues on the Board of Directors and members of the Foundation's Board of Directors who are here today, and some of whom are also watching remotely, as is so much of our broader organization. You know, when I first joined this organization in 2007, as a member of the Credit Valley Hospitals Foundation Board of Directors, as Carly mentioned, we were two separate hospitals with 3 sites: the Credit Valley Hospital, the Mississauga Hospital, and the Queensway Health Center. And then in 2011, as the Foundation's board chair, I was honored to be part of the team that announced the voluntary merger of the Credit Valley Hospital and Trillium Health Center, which then became this incredible Trillium Health Partners. 10 years ago, we made a promise to this community that together we would deliver the best quality patient-centered care that was accessible and sustainable for years to come. And you know, we've accomplished so much over the last 10 years working together. In partnership with U of T, for example, we launched the Mississauga Academy of Medicine. And in 2014, we launched the Institute for Better Health, our research and innovation hub. We became a founding partner of the groundbreaking Medical Psychiatry Alliance. And in 2020, we implemented EPIC, a new, modern, digital health record to improve patient care by ensuring that all of your medical information is in one place and that the operation of the hospital is incredibly efficient. These are just a few of the many accomplishments over the years. But you know, it was our culture of caring, innovation, and continuous improvement that allowed us to provide high-quality care during the biggest challenge I think we've ever faced, this pandemic. Our success has only been possible because of the more than 11,000 or 12,000 people who work with us each day and every day to deliver care, and also our amazing volunteers and our incredibly generous donors. Thank you to all of you for supporting us through these past 10 years. And now we look to the future. Today, it's an honor to be here, to witness something that we're so excited about, the next step in making that promise that we made 10 years ago a reality. This community, as you know, is growing faster than any other in this province. Our hospitals are outdated, and they're too small for the volumes we serve. People today have more complex health needs, and we've also seen a dramatic increase in poverty levels in this community. We're very excited to be here today to share our plans to help address these challenges. And I want to thank the Ontario government, including our local MPs, for your ongoing support to ensure this community gets the health care it needs. And of course, a longtime supporter and partner to THP, the Premier of Ontario, Doug Ford. You have been a tremendous leader throughout this pandemic, and we are grateful, so grateful for your support of Trillium Health Partners. And I know that with your continued support, we are going to change the way we deliver healthcare and truly create a new kind of healthcare for a healthier community. And with that, it's my great pleasure to invite you to the podium and to explain our incredible plans for the future. please welcome our Premier, Doug Ford.
First of all, thank you, Michelle, and thank you for your leadership, and thank you for the kind words and the warm welcome. And I have a couple of my favorite people sitting right in front of me, Michelle DeManuel and Mayor Hazel and Mayor Crombie. Thank you, because you've all been here almost right from the get-go. I know you have, Hazel. But, so, anyways, you know I love you, Hazel. But, well, first of all, good morning, everyone. This is a really exciting day, and I know, Michelle, you were saying you couldn't sleep, neither could I. This is a massive announcement, Canada's largest build for a hospital. But I want to begin by congratulating Trillium Health Partners on 10 incredible years of serving these communities. And on behalf of Ministers Elliott, Surma, Rashid, Tangri, and MPPs Cazzetto, Hogarth, Sabawe, Kusindova, and of course, yourself, Mayor. You've been a great partner, so thank you once again. I want to acknowledge the entire staff here at Trillium for their tremendous efforts during the pandemic and how grateful we are for all the work that they've done. I'd also like to give thanks to Carly Farrow. Carly, what a champion. Thank you again for your leadership. Dante Morrow and Michelle Darling for their continued leadership over the past months. It has been truly exceptional. My friends, in the face of big challenges, our government has a plan for growing a stronger economy, an economy that works for everyone. It's a plan that will protect our progress in our fight against COVID-19, but also looks beyond to the Ontario we want to build and the future for our kids and our grandkids. It's a plan that will bring investment and spur economic growth, and with that growth, more people and workers will come to our great province, seeking the opportunities that Ontario has to offer. To attract and keep the workers, we're investing in communities with better healthcare and stronger local infrastructure. That means saying yes to modern hospitals like we're going to be building here and more ICU capacity. And that means saying yes to building long-term care homes as we added thousands of nurses and personal support workers. And yes, we're building long-term care here in rapid fashion. That was the quickest build I've ever seen. I can't believe lightning speed. And again, thanks for your cooperation, Mayor. Well before the COVID-19 pandemic, our government promised to confront the growing problem of overcrowded hospitals and hallway healthcare. Years of neglect by previous governments meant Ontario's hospitals had to make do with inadequate funding levels, a lack of infrastructure, and no plan to handle a growing population. We're here today to say that our government is stepping up. We're getting long overdue shovels in the ground to build Ontario. We're making good on our promise to end hallway healthcare with a historic, and these are really staggering numbers, with a historic $30.2 billion investment over the next 10 years to renovate and expand hospitals around the province, not just in big cities and towns, but in communities all across Ontario who have waited too long for their government to deliver for them. As part of that unprecedented commitment, we're pleased to announce the multi-billion-dollar investment for the expansion and modernization of Mississauga Hospital and Queensway Health Centre and Trillium Health. You know, folks, I've made a lot of announcements over 3.5 years, but I'm getting goosebumps up and down my arms here. This is great news. So it's throwing me off my speech, but I'll get back to it. This is the single largest hospital infrastructure plan in Canadian history happening right here. For far too long, Ontario government's only patched holes in our most critical infrastructure, just getting the health system by on a day-to-day basis. It was a short-sighted approach, and our government is charting a new course. We're investing in building with the province's booming population growth in mind. The hospital expansion won't only mean shorter wait times for the people of Mississauga and Etobicoke today, it will mean better health care for our children and our grandchildren in decades to come. So thank you again to everyone who helped make this day possible. And if you don't mind, I'm just going to take a quick minute out. I'd like to speak about the evolving situation in the Omicron variant here. The discovery of the variant here in Ontario is cause for concern, but it's not cause for panic. Every day we learn more about the Omicron virus, about how quickly it can spread and how severe it may be. We're learning about how effective our vaccines are, and every day we hold off more cases entering our country, the more time we have to learn and prepare. So the best thing we can do right now is to fortify our borders. Our best defense is keeping the variant out of our country. We welcome the actions from the federal government, and I want to thank the feds for taking action to date. We implored them last week to act quickly and to be decisive on the borders, and they did. And we're pleased to see them respond to our calls, testing, and to be restarted the testing at the airports, which is absolutely critical upon arrival in our country. We will continue to call on them to be proactive and not wait to implement every measure needed to keep Canadians safe, because we cannot allow anything to jeopardize the gains that we've made. The good news is each of us has the power to help slow the spread of this variant and all variants. If you haven't already done so, please get vaccinated today. If you put off your second dose, please get your second dose. And if you're eligible for your third dose, book your booster appointment as soon as you're able to. And I'm so proud of the more than 109,000 young ones who have stepped up to get their vaccine. Those are pretty staggering numbers. 109,000 so far being vaccinated for the 5 to 11-year-olds. So thank you. And everyone, please continue to follow public health measures like wearing your mask and getting tested at the first sign of symptoms. Friends, we've come so far, we've sacrificed so much. Our government will never waver in our responsibility to protect the hard-fought progress. We will remain vigilant and cautious. We will stay alert to the changing nature of the virus and ready to respond. So I want to say thank you. God bless each and every one of you, and let's get the shovels on the ground. So thank you. Now I'd like to turn it over to the screens to each side of us, and we'll watch a video. Thank you.
We all deserve the best healthcare, and we believe that healthcare needs to work for everyone and leave no one behind. At Trillium Health Partners, we serve the most patients of any hospital in Ontario, in one of the largest, most diverse communities in the country. We have never waited for others to define our future. We have always defined it for ourselves. When the community was changing, we changed too. 10 years ago, we combined 3 hospitals because we believed that together we could create a new kind of healthcare for a healthier community. Then, in 2020, the pandemic hit. When everybody in the community was forced to stay apart, we stood together. When they did their part and stayed home, We did ours and went to work, and we didn't stop. Vaccines arrived, and we vaccinated the first person in Peel. We didn't stop until we delivered 500,000 doses of hope. But our work isn't done until everyone has the health care they deserve. That's why we're launching Trillium HealthWorks. Trillium HealthWorks means a new Mississauga hospital, expanded Queensway Health Center, and stronger community partnerships. It will mean more beds, doctors, nurses, and allied health professionals, shorter wait times, and greater specialization closer to home. But it's about more than that. We are not leaving anyone behind. We're preparing for the healthcare challenges of tomorrow, today. We are looking beyond our walls to find new ways to meet the community's needs. Making this change happen won't be easy. It will take all of us working together with compassion, excellence, and courage. And together, we will make healthcare better for everyone. We all deserve it.
So, thank you, Premier. Thank you for the announcement, but thank you mostly for your commitment. It has been unwavering, and we felt it. We can feel it in your heart and soul when you speak to us. We felt it every day of the pandemic, and we know your government's been taking action to make sure this healthcare system works for the people who need it. And so we are so grateful to be partnered with you today, during the pandemic, and before. For a hospital like ours, where hallway medicine has been a reality because services have not kept pace with the need, your commitment to change has meant everything. This historic announcement will change the delivery of healthcare for the decades ahead. And most importantly, it means changing the system so that healthcare works better for everyone. So thank you for your support, your commitment, and your announcement. It's now my pleasure to introduce the Deputy Premier and Minister of Health, Christine Elliott. Minister Elliott is no stranger to Trillium Health Partners. We have worked closely with the Minister throughout the pandemic and before, and are grateful for her tireless leadership and unwavering focus on the health and safety of all Ontarians as we have battled COVID-19. Beyond the integral role that you have played, Minister Elliott, guiding our province through the challenges of a global pandemic, you have also been a leader in modernizing our healthcare system, from acute to mental health to primary care. Through your leadership, there is an emphasis on being patient-centered and more connected to make the system work better for people. So we are so pleased to have you join us today.
Well, thank you very much, Carly, and good morning, everyone. This is truly an incredible day for Trillium Health Partners, one that I know you've been waiting for many years. So it's really a pleasure to be here to celebrate your 10th anniversary, but also this amazing news with respect to the redevelopment. And to begin, I want to extend my sincere thanks to the healthcare workers, staff, and leadership team at Trillium Health Partners for your commitment to providing exceptional care to patients, particularly throughout the COVID-19 pandemic. From administering COVID-19 vaccines to establishing 2 COVID-19 assessment centers and quickly increasing your hospital capacity, you have risen to every challenge with creativity and determination. We cannot thank you enough for going above and beyond to keep Ontarians healthy and safe. Thank you. Now, long before any of us had heard of COVID-19, our government made a commitment to end hallway healthcare and build a better, connected healthcare system centered on the needs of patients. Today, we are delivering on that commitment to patients and families in Peel Region, Etobicoke, and the surrounding communities by making a historic investment in the redevelopment of Trillium Health Partners. Every year, over 1.7 million patients are treated at Trillium Health Partners, and that number is only expected to grow. Over the next 20 years, the hospital is expected to grow 7 times more than the average hospital, with the demand for acute care services expected to grow 120%. The redevelopment of Trillium Health Partners will be the largest hospital infrastructure project in Ontario's history, ensuring that patients now and for generations to come continue to receive exceptional care. Our government's investment will support a new state-of-the-art Mississauga hospital, expand Queensway Health Centre to include a new inpatient tower, and add over 600 new hospital beds across Trillium Health Partners. The new Mississauga hospital will replace aging infrastructure with state-of-the-art facilities, including one of the largest emergency departments in the province, as well as new operating rooms. In addition, the Queensway Health Centre expansion will include a new inpatient care tower. The expanded hospital will centralize complex continuing care and rehabilitation care. But that's not all. As we work to build these modern health facilities, our government is also making other key investments to support high-quality care for the nearly 850,000 patients Trillium Health Partners currently serves. This includes increasing Trillium Health Partners operating funding for the 3rd straight year, with over $27 million in additional operating funding starting in 2021-22. Today truly is a historic moment for your community. For 10 years, Trillium Health Partners has been serving patients in Peel Region, Etobicoke, and the surrounding regions. And this investment will ensure that you can continue to do so for many, many years to come. Congratulations to Trillium Health Partners and all the community builders who have come together to make this project possible. Together, we will ensure that people in your community can access the care they need now and in the future. So thank you very much, and I would now like to pass it back to Carly to introduce the next speaker.
Thank you so much, Minister. And as we describe the size of our new infrastructure projects, it is important to acknowledge that the need is greater for our communities, and we have felt it, and we have worked in partnership with this community and with our government to address those needs, and we will continue to do that, but this announcement is making a difference. Thanks for your commitment to making choices based on the needs of the community. It makes a difference to us, and your tireless commitment to making the healthcare system better. So with that, I'm going to move on to our next speaker, a true partner and friend to Trillium Health Partners, the Mayor of Mississauga, Bonnie Crombie. Mayor Crombie is a passionate supporter of the hospital. As this community battled the pandemic over the last 20 months, our mayor stood beside us every step of the way, working to bring together all parts of the community to ensure the pandemic response was what the community needed. But what also meant the world to us is how she showed up in person, making several visits to the hospital to cheer us on, to deliver PPE, to serve meals. We are so grateful for your leadership and support, and we are very honored to have you with us here today for this historic announcement.
Well, thank you, Carly, for that very fine introduction. It was very kind of you. Let me also introduce a few members of my team who have joined me here this morning. I see our city manager, Paul Mitchum, is here. I know he will provide a lot of leadership on this. Thank you. Councillor Stephen Dasco from this area, Ward 1. Stephen, thank you for joining us. Councillor Chris Fonseca is here with me from Ward 3. Councillor Ron Starr from Ward 6, and of course Councillor Matt Mahoney is with us here today as well. Hope I didn't forget anyone. I'm good. Great, thank you. So first and foremost, I want to congratulate Carly, you and your team here at Trillium Health Partners for your 10-year anniversary. This is a truly historic day for our city and for our people, and I can't think of a better time to make this particular announcement. Premier Ford, to you, to your team, to the ministers, and to our local MPPs, and let me add to Michelle Emmanuel, who have been tireless advocates for this project. Thank you. Thank you to all of you. Today simply would not have been possible without you. Secretly, I know many of you must be slightly relieved knowing that I won't be constantly bugging you about making this project a reality, and let's make it happen soon. But you have listened. You've listened to me, you've listened to the people of Mississauga, and we appreciate that the need in our community will be fulfilled. So, on behalf of the City of Mississauga and our residents, I want to thank you for this incredible investment in our community and in our future. Today's announcement truly is the culmination of years of hard work and dedication from the team here at Trillium Health Partners. Their honorary guardian, the one and only former Mayor Hazel McCallion. Cheers for Hazel. This woman understands the needs of our community and has been a tireless advocate for world-class healthcare here in Mississauga. Hazel, thank you. And of course, the members of our community who time and time again stepped up to show their support for our hospital through actions large and small. As Mississauga is growing and changing, so are our healthcare needs. It is a well-known fact that Trillium Health Partners will experience more demand for services than any other hospital over the next 20 years. In fact, that's 7 times more than the average hospital in the province. And while the team here at Trillium Health Partners has done so much for our community throughout this pandemic, it has frankly brought to light some of the real limitations of the Mississauga site, which is why today's announcement is an absolute game changer. Not only will it increase capacity and reduce wait times for residents, but it means Mississauga will soon be home to one of the largest and most innovative hospitals anywhere in Canada. This new hospital will be capable of supporting our growing community and those across the GTHA with cutting-edge treatments that will improve and save lives, creating thousands of highly skilled jobs and grow our economy. And by opening the door to innovative collaborations between Trillium Health Partners and other leading private and public sector partners, ensuring Mississauga remains competitive on a world stage. It will also build a sense of community and change the landscape of the corner of Hurontario and the Queensway, and will be fully accessible and serviced by the Hurontario LRT Premier. Yet another transformative project Premier Ford and his government are supporting because they understand just how critical building a complete and connected Mississauga is to our people and our future. Thank you, Premier. You've heard me say it before, and I'll say it again. Mississauga is growing and changing for the better. This is really a huge day for our city, and one that will not be forgotten anytime soon. And I want to once again thank Premier Ford and his team for this very transformative investment, and to Trillium Health Partners leadership and staff for the incredible work that you do to keep our city healthy and safe. And of course, to the many generous donors who are helping us build this new hospital that will raise the bar and set a new standard for healthcare in this country. Together, we will build back better. Thank you.
Thank you, Mayor Crombie, for that inspiration and that gratitude which we all share. So, our final speaker today really needs no introduction, and if you thought you had goosebumps before Premier, wait till we get our guardian up here. Without Hazel McCallion, we simply wouldn't be where we are today. When I first joined this organization 12 years ago, I quickly learned that I was joining a way of thinking, the Mississauga way. And it was a way of thinking that's epitomized by you, which is you have told us, shape the future, don't wait for it. And it helped guide us. It helped bring the legacy hospitals together 10 years ago, and it's guided all the decisions we've made since. So you have spent your life advocating for us, and we are grateful to have you as our guardian and here today. So please join me in welcoming the most amazing Hazel McCadden.
Thank you very much, Madam President. You are doing an outstanding job, following the outstanding job done by Michelle. Mr. Premier, Madam Minister, it is such a delight to be here today. I remember well the day that the board chairman of the Mississauga Hospital came to me as mayor and said, we're putting the 3 hospitals together. One administration, and of course he knew Mississauga manages money extremely well. So I knew that the cost of hospital care in Mississauga would be well managed under one administration. And Michelle was the one chosen. She came to see me, applied for the job, and she wanted to know about my support. And she told me about what she was doing at the hospital at the Mississauga. She said, I go into the operation room, and she said, I show them how to really clean up. She said, I show the women that clean up the room, you gotta scrub. You gotta scrub. You don't just wipe the thing. I said, you're the person for the job. I want to thank you, Mr. Premier. Trillium Health Partners are shaping the future of healthcare. Trillium Health Partners does not just deliver health services. They do research. How can we improve the system? And that is so important because, you know, we get so accustomed to doing everything every day one way. Not Trillium Health Partners. They want to do it differently. They want to make a contribution to healthcare. And if there's one thing, Mr. Premier, this pandemic has taught us, we need more hospital care. We need more beds, and that's why you have announced. Because when I sat there, you know, I have a lot of time to watch TV now. And I see hospitals having to transfer patients from one hospital to another because there isn't enough beds. So folks, not only does the government work towards improving our health care and providing more hospital beds, the public must get behind it. The citizens must get behind it. And we have a wonderful foundation in Mississauga. I can assure you they raise a lot of money. And I was so proud of the book that was done on my life. I think they've raised $4 million on that. So we have to get behind healthcare. A city, I remember the old farmer that came to see me as mayor of Mississauga, that was chairman of the building of the Mississauga Hospital, Mr. McCarthy. And he came and he said, Madam Mayor, we need another hospital. I said, oh my gosh, another hospital? And that's how the Credit Valley Hospital started, was at my kitchen table. An old farmer came and told me we need another hospital. And thank God we built the Credit Valley Hospital. I don't know how we would have been able to care during this pandemic without the Credit Valley Hospital. Mississauga Hospital needs rebuilding. It's old. It's serviced this city for so many years. Built in 1955. We need a new hospital. And Mr. Premier, the money you're investing in, Madam Minister, in Trillium Health Partners to build a hospital, in my opinion, they're the most qualified to fulfill your vision of excellent health care in this area. So, thank you and have a great day.
Thank you, Hazel. So much of what we are celebrating today came from what started at that kitchen table that she described nearly 50 years ago. You have always believed in building better healthcare for this community, and today marks the next step in our journey. The next step in reaching our goal to create a new kind of healthcare for a healthier community. It's the way we've always thought. When we came together 10 years ago, since that time, we have reinvested $125 million because we've been able to do better as one organization into frontline care, just as one example of the great things that have come from Trillium Health Partners. But of course, it's so much more than construction projects. It's about designing care around the needs of patients and improving the patient experience and the future of healthcare for this community. 10 years ago, we knew it's what our community needed, and we set out to make that change happen, to deliver the best possible care, to meet the rapidly changing needs. We knew we needed to change and grow to meet what this community has, which is a diverse and amazing population, but that's growing rapidly. With this investment today, we're setting out to change again, but we're not doing it alone. We believe, and that's why our name is Trillium Health Partners, when it comes to healthcare, we're all in this together. It's why today we stand together. Government, community partners, our patients and families, over 12,000 people who I represent who are working, practicing, learning, and volunteering at the hospital. We're looking out the next 10 years now. Building better healthcare is building a better community. So I will close with a quote from the famed American poet Maya Angelou, who said, "Do the best you can until you know better. And then when you know better, do better." So thank you for being here today and sharing the joy of this announcement. And at this time, I'd like to ask the Premier and the Minister of Health to come back to the stage to take media questions.
Okay, we're ready to take questions for the media here today. If you have a question for the Premier or Minister Elliott, just line up behind this microphone. Just a reminder, it's one question, one follow-up, and we'll try our best to get to as many of you as we can.
Hi, Premier.
Hi.
So on the small business grants, more than $210 million were paid to ineligible recipients, according to the AG, and the province chose not to recover the money. Why is the government wasting taxpayer money?
Well, we don't believe in wasting taxpayers' money. We put out $3.3 billion, if you put that into perspective, and similar to the federal government, when we're rushing the money out the door to support the small businesses that were in desperate need of it, unfortunately, you're going to see some fraud, and we don't take that lightly. We're going to always continue looking into it, seeing where we can improve, and but there's a lot of people that were supported to a tune of $3.3 billion, not once, but twice. We gave the first grant, and then we doubled it up shortly thereafter. But I think more people benefited than got hurt on that. Thank you.
I have another question.
Yes.
What additional measures is Ontario considering to address the Omicron variant? When is the third dose strategy being rolled out?
Well, first of all, the third dose, and then I'm going to pass over to the Minister of Health. The third dose, as you can see, it's out there right now, and we're making sure that people are going to be getting tested. We've asked the public health and our health team to increase the testing, increase tracking and tracing. The reason we were able to find the folks that had this variant is because of the incredible job of the tracing team, that we were able to trace it right down to the people directly and have them isolated. but we're going to make sure that we're very cautious and enhance everything we possibly can. Again, when I spoke to the feds, they stepped up, and now they're going to be increasing the screening at the airports. They've added 3 more countries on the list of not being able to visit us, at least at this time. But I'll pass it over to Minister.
There's still much that we don't know about the Omicron variant, and the extent of the transmissibility, the virulence, and the how safe and effective our vaccines are. But we're continuing with all of our precautions. As the Premier mentioned, we have a great system for testing. We have case and contact management that has followed up with all 375 people who had traveled to the first South African countries that were mentioned. We're going to continue doing that work with the testing and follow-up and ensuring their quarantine. But we're also continuing with our vaccinations. We're doing really well with that. We're at 89.9% with people 12 years and up with the first dose, 87% with people with the second dose. We've already vaccinated over 109,000 children aged 5 to 11 in the last 10 days. And we're continuing with our booster dose strategy as well. We'll have more to say about that with respect to age categories within the next few days. So vaccination continues to be one of our most important elements, as well as working with the federal government to keep our borders closed to certain countries right now until we know more about this variant.
Hi, Premier. Laura Stone, Globe and Mail.
Hi, Laura.
Hi. We understand that the federal health minister had a meeting with the provinces and territories yesterday regarding border issues. And I wonder what you make of extending the testing and isolation requirements to the United States. Do you think we should do that? Why or why not?
Well, first of all, it was my request to the federal government, and they acted very quickly on that request, and I appreciate the collaboration. As a U.S., we'll have further discussions with the federal government and the other premiers and the territories as well to get, because it doesn't just happen in Ontario, it's right across the board, as you're well aware of. But again, I'm glad that we've enhanced the testing at the airports, and we've added 3 additional countries onto the list of travel.
Why do you not support extending it to the United States? Like, what would be the reasoning behind that for you?
What, not allowing people?
No,
I
sorry,
apologize.
The U.S. is currently exempt from this new testing and isolation regime.
Well,
I just wonder why you're not calling for that.
Well, that's a conversation we'll continue to have right up to today and tomorrow, and then we'll make that decision. But we're going to be super cautious. Everything's on the table right now, so we're not going to leave anything out. It just hasn't hit that point yet, and they're going to have further conversations with the federal government. And I want to give a shout out to Minister LeBlanc. When I give him a call, I've never seen a customer service person, bang, return calls as quickly as he is. I joke customer service, but he's a great minister. And man, does he respond quickly. So I want to thank Minister LeBlanc for his cooperation.
Hi there, Premier. Lorenda Redekop with CBC
Hi,
News. Hi. I wanted to follow up first with that first question about the Auditor General's findings that your government gave more than $200 million in COVID relief to ineligible businesses. You mentioned fraud. Do you believe that there was fraud here? And
I call it being dishonest, and you know, when you know you're under a category and you kind of switch things a little bit, again, when you're handing out $3.3 billion, you're going to see things like this happen. Does it go back into the economy? Sure, it goes back into the economy. Did we have to move quick? We had to move in lightning speed, but there always have to be accountability, and we'll make sure people are accountable, and we're accountable for that as well.
the program, though, it wasn't done in a big rush since it was many months into the pandemic. So what happened? How did you let it happen?
Actually, we're going to respectfully disagree. It was a rush. We were getting businesses that were shut down. They were in desperate need of funding. We supported them by funding. Not only did we give them grants that they won't have to pay back, we took care of their electricity costs, tax bills, water bills, in conjunction with the federal government, rent. We also took care of the payroll along with conjunction with the federal government. So it was all hands on deck, and more people were helped than were hurt.
Yeah, I just wanted to follow up on the question about PCR testing to the United States, the people visiting land and air. Do you support it?
Well, I'd always support anything that can be cautious to prevent this variant coming into our country. So again, we'll have a discussion with the federal government. That's their jurisdiction, it's not ours. They work collaboratively with all the provinces and territories. And I'm always for going the cautious route, as I think people have seen over the last 20 months. I'll side on the side of caution.
So just to be clear, it'll be something you'll support, something you'll push for?
Again, I'll have that conversation with the federal government and the premiers, because it's not just one province situation. We'll sit down and discuss that. But I'm always on the side of being more cautious, and it doesn't take much to get a test at the airport.
Nicole Thompson, the Canadian Press. You said in your opening remarks that every day we hold off more cases entering our country, it gives us more time to plan and prepare. What specifically is the province planning to deal with the Omicron variant?
Well, I'll go back to what we just spoke about, the borders. It's coming in from other countries, and we're working, again, collaboratively with the federal government to tighten up our borders, to make sure that we're testing everyone that's coming in from the designated countries, but other countries as well. Because what happens is they go from one country, jump to another, and then fly into Canada. So we have to be cautious on all fronts.
And those are federal measures. What is the province doing?
We're working collaboratively with them. We're also increasing testing, making sure that we have the capacity to test more people, which is absolutely critical, and the tracking and tracing. Once we find someone that tests positive, we can make sure that they're notified and they actually stay at home for a couple of weeks. So, but it's all hands on deck, and we're just going to continue working hard with our health partners.
This will be our final reporter.
Hi, Premier.
Hi.
Just going back to the Auditor General's report and
Yes.
the business money. So how do you justify not knowing where the money went, if it actually helped the businesses who needed it most, just based on what was already asked you previously?
Okay, well, I appreciate the question again, and I'll answer it again. There was $3.3 billion. We did get the money out the door extremely quickly, and with any volume like that, you have to take into consideration that, as I mentioned, maybe it's a strong word, fraud, but when someone's misleading their application, that's not right. When someone's saying they're one company and it's actually going to another, that's wrong in my opinion. But $3.3 billion went back into our economy, helped businesses stay afloat, and because of those grants, companies are still in business today because of the help that we provided right across the board, not just the $3.3 billion in grants, but again, the electricity, the rent, the water bills, the hydro bills, the payroll. We went all in. We put billions and billions of dollars in to support small businesses to keep them on their feet, and it worked. Thank you. Okay, thanks, everybody.
Okay, so that concludes our festivities, and thank you all for being here. Thank you all for embarking on this future with us. Have a wonderful afternoon. Stay safe.